So there are a lot of women who struggle when they're exclusively breastfeeding with the idea of being intimate with their partner. Hello, everyone. Once again, Dr. Rush coming to you from the beautiful city of Miami. I'm typically based out of Brooklyn, New York, but I am again spending some time in my happy space here in Miami. Today, what I wanted to discuss is another somewhat obstetric topic, I guess. And that is why women have decreased libido when they are breastfeeding. So as I may have mentioned in some of my other videos prior to this, I recently just became the mother of my 8th baby, Mr. Liam Aiden Beach. And he is such a nice little chocolate drop treat. He's such a cute little boy. And we are so extremely happy to have him. I have so many wonderful helpers, and he's just been he's been a delight. And of course, I'm not always a fan of waking up every 2 to 3 hours to pump. Hey, such is life. I've been through this 8 times. I should know the territory by now. So there are a lot of women who struggle when they're exclusively breastfeeding with the idea of being intimate with their partner. Whether that is a female partner, male partner, whatever the case may be, or both. And a lot of times they just cannot fathom the idea of even wanting anyone to touch them. And I know a lot of women become very distressed about that because sex is a natural part of a relationship, or some relationships, or many relationships. Not all relationships, but many of them. With that being said, a lot is going on with a woman physiologically after she has a baby, and also when she's breastfeeding. There are a lot of hormones that are trying to settle themselves, that are trying to get back to normal, that are non-pregnant hormone levels that a woman was encountering when she was pregnant at much higher levels than what she encounters when she's not pregnant. One of those things is estrogen. Estrogen is the driving force behind a lot of stuff women related. And it also can be the driving force behind libido for some women, and for many women actually. And when women have lower estrogen levels, they oftentimes do not either desire sex, or they end up with vaginal dryness that then leads to them not wanting to have sex because sex becomes painful. During breastfeeding, the estrogen levels are a bit lower than they normally are otherwise. When women are breastfeeding exclusively, they may encounter this a little bit more often. And what do I mean by breastfeeding exclusively? That means not supplementing with anything else, such as food or other things like formula. So when your baby is getting exactly all of its nutrients, as far as milk, directly from you, not any other source. You're not supplementing with any baby food or anything like that. That's exclusively breastfeeding. Many women, like I said, who do exclusively breastfeed do have issues with libido, especially within the first few months. A lot of that can also have to do with them being tired, and just being simply exhausted, and also just having a baby attached to them every 2 to 3 hours in nursing, or if the baby is not attached to them, they're pumping every 2 to 3 hours. And that can be overwhelming. It can be a bit distressing from time to time. It's a beautiful thing. It's a wonderful thing. And women embrace it, but it's also not for the faint of heart. And it's not really easy to keep up with for a lot of women, which sometimes can lead to them eventually giving up breastfeeding a little bit earlier than what they like. But the one thing that I want to convey in this video is the fact that this decreased libido does not last always. It can eventually ramp up again. Even when you are breastfeeding exclusively, your body will start to normalize as far as the hormones go. And when you're maybe about 3 to 4 months into your breastfeeding and you've established a good milk production, you've established a good routine with you and your baby, and or you're pumping, then you may also, number one, be getting a little bit more rest. You may be a little less anxious about the whole breastfeeding thing and what's required of you when it comes to that. And that in and of itself can also lower stress levels and make thinking about being intimate with your partner a reality, as compared to you just being so exhausted and tired that you can't even fathom that. So I want to just say that for those women who are experiencing this issue, it's not unusual. It is very normal, but you also will go back to normal. You will go back to a normal state of being able to be affectionate, of being able to be intimate. Now, there are times where that can be a bit of a struggle for women. And sometimes if they've had a traumatic birth experience, if they have had a vaginal laceration during the time that they were giving birth that had needed to be repaired, and now they're, experiencing significant pain during sex, those things can sometimes lead to a woman not wanting to be intimate. And that is quite understandable. As I mentioned before, pain during sex is something that's always, a lot of times going to lead women to be a bit reluctant to want to have sex because it's painful. So what I would encourage you to do if you are having some difficulties with libido and you notice that it's causing significant issues within your relationship, speak to your doctor, because sometimes it may not necessarily be just the hormones. It could be other things. Some women may have dealt with trauma in their lives that, birth and, having a baby may have, eventually brought up again. And that is somewhat of my story as well, in terms of some trauma that I've experienced in my life that when I have my baby sometimes becomes a little bit more prevalent, and I think about it and have more flashbacks, and that can be an issue. But other times it can just simply be physiologic. And, as I always say, knowledge is power. So being able to discuss this with your physician, having that conversation about what is actually going on, what you're experiencing, what you're feeling, what the reluctance is, and just trying to simply convey what it is that you're experiencing can sometimes allow your physician or a practitioner to pick up on what is going on and what may be necessary for you to get over this. If you have any questions, you can always send me comments. If you have any other concerns, you can always send me comments, but also reach out to your own practitioner as well. I think that serves a lot of women well when they understand what is actually happening. But most importantly, like and subscribe. I will bring more of these topics to you, things that a lot of times we don't get a chance to talk about from day to day, things that women are scared to talk about or to even ask about. That's what I'm here for, to be able to bring up some of those topics and to make them simple and understandable. So again, like and subscribe. This is Dr. Aisha Rush signing off again from that beautiful sunshine state of Florida. You guys take care. Have a good night.